Hi everyone, welcome back to Living a Balanced Life with Julio. My name is Juliet. I'm a registered nurse, a diabetes educator, and certified bariatric educator. On today's episode, I'm going to talk to you about hypoglycemia or low blood sugar. Even though diabetes is associated with high blood sugars, sometimes depending on what's happening, a person with diabetes can have a low blood sugar or hypoglycemia. We're going to talk about the signs, the symptoms, what causes it, and ways you can manage it so you can be in control. Throughout the day, depending on the multiple factors, blood sugar or blood glucose level can vary up or down. This is normal. If it varies within a certain range, you probably won't be able to tell. But if it goes below a healthy range and it's not treated, it can get very dangerous and can cause problem for a person with diabetes. So what is hypoglycemia or low blood sugar? Low blood sugar is when the amount of blood glucose or sugar in your blood has dropped below a target range that is less than normal, which is less than 4 millimoles per liter. Each person's reaction to low blood sugar is different. Learn your own signs and symptoms of when your blood sugar level is low. Taking time to write these symptoms down may help you learn your own symptoms of when your blood sugar is too low. The normal blood sugar target before meal for a person with diabetes is anywhere between 4 millimoles per liter to 7 millimoles per liter. So when your blood sugar falls less than 4 millimoles per liter, that's when your body starts to warn you that the sugar is too low, and this can be very dangerous, called hypoglycemia. So what are some of the symptoms of hypoglycemia? A person may feel shaky, lightheaded, nauseated, nervous, irritable, anxious, can cause confusion, unable to concentrate, extreme hunger. Your heart rate may be faster, so palpitation. You could be sweaty, you can have a headache, weak, you can get drowsy, numbness or tingling in your tongue or lips, and it can lead to nausea, like I said earlier. Low blood sugar can happen quickly, so it's important to treat it right away. If your blood sugar drops very low, you may need a help from another person. Very low blood sugar can make you confused, disoriented, can make you lose consciousness, and it can even cause seizure and can put a person in a coma if it's extremely low. Not everybody that has diabetes that's having a hypoglycemia episode or low sugar episode will feel all these symptoms, but you will feel a difference in the way you are, your mood, your symptoms, and this is your body's way of warning you that something is wrong. So whenever you feel these symptoms, it's important for you, if you have your machine that you use to check your sugar, to check it right away to see what number you're at. The only way for you to know whether you are experiencing low blood sugar or hypoglycemia is if you check your blood sugar level, if possible. If you're experiencing symptoms and you are unable to check your blood sugar for any reason, then you should treat the symptoms. You should treat the hypoglycemia. When your body is in a hypoglycemia state or your blood sugar continue to drop, a low blood sugar level will trigger the release of a hormone called epinephrine that puts you in the fight or flight response. This is a hormone that causes the symptoms of hypoglycemia, such as increased heart rate, sweating, tingling, and anxiety. This is your body's way of warning you that something is wrong. If the blood sugar level continues to drop, the brain does not get enough glucose or sugar and stop functioning. This can lead to blurred vision, difficulty concentrating, confused thinking, slurred speech, numbness, and drowsiness. If your blood sugar stays low or continue to drop, it might cause starving of the brain of glucose or sugar. This may lead to seizure, coma, and very rarely can cause death. So it's very important as a person with diabetes for you to know your symptoms of hypoglycemia or low sugar and what to do when this happens. Some of the things that can cause hypoglycemia include doing more physical activity than usual, not eating enough at all, not eating on time, so skipping meals, eating less than you're supposed to eat, taking too much medication. So some medication can cause low blood sugar, like insulin or sulfonylureas can cause hypoglycemia. So taking too much of those medication can do that. Drinking alcohol within the past 24 hours can cause a low blood sugar or can cause your blood sugar to drop after 24 hours after drinking. Some people have a greater risk of diabetic hypoglycemia, and these people include people that use insulin, like I said earlier, people taking certain oral diabetes medication like sulfonylureas like glyburide, diamacron, people, younger people and older adults can also have an increased risk. Those with impaired liver or kidney function, people who have had diabetes for a longer time have a higher risk of getting hypoglycemia. People who don't feel the low blood sugar symptoms, so people that are unaware of their hypoglycemia symptoms, those taking multiple medications, anyone with a disability that prevent a quick response to falling blood sugar level have a higher risk of experiencing hypoglycemia, and people who drink alcohol. Some of the complications of hypoglycemia or low blood sugar can happen if you ignore the symptoms of hypoglycemia too long. You may lose consciousness. It's very important that you recognize the symptoms of hypoglycemia to prevent yourself from getting so sick from the episodes. That's because your brain needs glucose to function. Recognizing the signs and symptoms of hypoglycemia early, because if untreated, hypoglycemia can lead to seizures, loss of consciousness, and even death. Take your early symptoms seriously. Diabetic hypoglycemia can increase the risk of serious, even deadly accidents. How you can prevent and help yourself from hypoglycemia is monitor your blood sugar regularly. Depending on your treatment plan, you may check and record your blood sugar level several times a week or multiple times a day. Careful monitoring is the only way to ensure that your blood sugar level remains within your target range. Don't skip or delay meals or snacks. If you take insulin or oral diabetes medication, be consistent about the amount you eat and the timing of your meals and snacks, because skipping meals can cause low blood sugar and for your sugar to drop. Adjust your medication or eat additional snacks if you increase your physical activity. So on the days that you're exercising, you know you're going to be exercising more than usual, then have a little bit of snack or have some snack on you that after the exercise you can take to prevent your blood sugar from dropping too low. Eat a meal or snack with alcohol. Very important. So if you have diabetes, it doesn't mean that you can't have alcohol. Of course, we encourage you to drink in moderation. So for those that drink, for men, 14 standard drinks per week. For women, no more than 9 drinks per week. And when you drink within this limit and you are drinking with a snack, then that can prevent you from getting hypoglycemia. Drinking alcohol on an empty stomach can cause hypoglycemia. Alcohol may also cause delayed hypoglycemia hours later, making blood glucose monitoring even more important. So if you drink alcohol, or if you're someone that don't drink often and you had something to drink, keep a close eye on your blood sugar and monitor it more closely to see how you react to it, because alcohol can cause hypoglycemia up to 24 hours after drinking. Make sure that whenever you have a low blood sugar reaction, that you record it down, because everybody is different. How my body reacts to hypoglycemia will be completely different from somebody else. So some of the symptoms that I mentioned, not everybody experience all of them, but you will experience some of them. So know how your body reacts when your sugar level is low and record these symptoms down. So next time, if it happens, then you know it will help you recognize it, and then it will prompt you to treating it right away. Carry some form of diabetes identification so that in case of an emergency, others will be able to help you and know that you have diabetes. So using medical identification necklace or bracelet and your wallet is a good way for you to, just in case you have hypoglycemia, that people will be able to help you sooner. Okay, so now let's talk about some of the treatment. So now you know that the symptoms of hypoglycemia, what could cause hypoglycemia, and the seriousness of it. So what do you do when you experience hypoglycemia? If you're experiencing the sign of low blood sugar, check your blood sugar immediately. If you don't have your meter with you, treat the symptoms anyways. It is better to be safe than sorry. If you check your blood sugar and it's a true hypoglycemia, meaning your blood sugar level is less than 4 millimoles per liter, then what you need to do is you need to use a 15-15 rule to treat the hypoglycemia. So the 15-15 rule means that you need 15 grams of glucose or sugar in the form of glucose tablets, or in the form of regular sugar, or in the form of a tablespoon of honey, or in the form of 6 lifesavers candies, or in the form of 3/4 of a cup of regular juice, not diet juice, regular juice. Because when your blood sugar is dropping, you need fast acting sugar. So you need sugar that goes in your bloodstream and raises your blood sugar within 15 minutes, right? Because you don't have that much time for food to get digested and all of that. So you need to treat it with fast acting sugar. And the fast acting sugar is 15 grams of glucose tablets, 1 tablespoon of honey, or 1 tablespoon of regular sugar diluted in water and drink, or 3/4 of a cup or 150 ml of juice or regular soft drink like pop, 6 Lifesavers candy, or 2 rolls of rocket candy. So you use one of these methods to treat your hypoglycemia. Not all at once, just one method. After you've treated the low blood sugar with one of the methods that we've talked about, then you're going to wait 15 minutes. So you wait 15 minutes after you treated the hypoglycemia, and then you need to check your blood sugar again. If you check your blood sugar and it's above 4 millimoles per liter, then the next thing you need to do is have a meal within the next hour. So have a snack or have a meal. If you check your blood sugar 15 minutes after the treatment, and if your blood sugar is above 4 and that your next meal is longer than an hour away, then have a snack, because you don't want to have the sugar dropping again. If you check your blood sugar after you treat it and it's below 4, so it didn't go above 4, it's below 4, then you need to repeat the treatment. So if you treated the low blood sugar with, let's say, a tablespoon of honey, 15 minutes later you wait and you check and it's still below 4, then you need to take another tablespoon of honey to treat it again. So you repeat the treatment until your blood sugar is above 4 millimoles per liter. Once your sugar is above 4 millimoles per liter, that means your sugar is within target. So now you sustain your blood sugar by eating a meal if the meal is within an hour. If it's not, then make sure you have a snack to prevent the blood sugar from dropping. So that's how you treat hypoglycemia, the 15-15 rule. You use 15 grams of fast-acting sugar to treat your hypoglycemia. You wait 15 minutes after you've treated it to see if the treatment work, and then if the treatment work, you sustain it with a meal or with a snack. And if it's still below 4, then you need to repeat the treatment until your blood sugar is above 4 millimoles per liter. Because remember, normal blood sugar target for before meal is anywhere between 4 to 7 millimoles per liter. Some of the snack ideas that you can have could be 7 crackers or 1 slice of bread with some protein like nut butter or cheese with it. Yogurt with some nuts. You can have a piece of fruit with some nuts. These are all great snacks to have to prevent your blood sugar from dropping too low. So we can all be safe out there. It's important that if you have diabetes, that you are aware of your hypoglycemia or your low blood sugar symptoms, and you have treatment on you that you can use just in case it happens. So when you're leaving the home, make sure that you carry something on you or in your car that you can grab if the sugar starts to drop. It's very important that when you're driving, that your blood sugar is above 5 millimoles per liter. So for driving, your blood sugar needs to be above 5 millimoles per liter. If you have a hypoglycemia episode while you're driving, you need to pull over, check your blood sugar to make sure that it's actually low. And if it is low, then you need to treat it. If you don't have a meter, then you need to treat it right away. So assume it's low and treat it anyways. After you treat hypoglycemia after driving, you need to wait until your blood sugar is above 5 millimoles per liter before you start driving. That's the recommendation. Your brain might need up to 40 minutes to recover before you can safely drive again. So when you have a hypoglycemia episode, pull over and give yourself 40 minutes before you start driving. It's important when you're driving that your blood sugar is above 5 millimoles, because if your blood sugar drop while you're driving and you got into a car accident, you can hurt yourself, you can hurt others. So it's important to make sure your blood sugar is above 5 before driving, and also have a meter in your car that you can check, and have treatment in your car just in case your blood sugar drop, because we all need to be safe and take care of each other. So remember, now that you've experience hypoglycemia, it's important for you to think about why your blood sugar went low and make the necessary changes to avoid the low blood sugar again. Make sure that you always wear your medical alert bracelet or identification and talk to your healthcare professionals like your doctor, your diabetes educator about prevention and emergency treatment for severe low blood sugar. Sometimes when our blood sugar has been high for a long time, we may experience some of the symptoms of hypoglycemia with our sugar not being actually low. So when you can, always double check to make sure your sugar is low before treating it. It's important as a person with diabetes to make plans on times you're not well enough to treat your low sugar. So hypoglycemia can happen and a person can be too sick for them to treat themselves or too sick for them to even swallow any of the treatment that we've talked about. So in this case, you will need an assistant from a family member or a friend. So it's important to let your family members and friends know what to do if your blood sugar drops severely, or if they find you unconscious, or if you have slurred speech and you're not able to swallow. What can they do to help you? So just like you use insulin to bring blood sugar down, there's a hormone called glucagon that also is in the body that regulate blood sugar to bring it up when the sugar is low. So when a person is having a severe hypoglycemia reaction and they're not able to swallow, they will need assistance of their family to give them the glucagon injection. And this is something that you can discuss with your diabetes educator to have it in place and to educate your family. Glucagon is available by prescription and is either injected or administered or puffed into the nostrils. For those who are familiar with injecting glucagon, there are now 2 injection glucagon products on the market. So speak to your healthcare provider so you can get a prescription of glucagon that you can have in case of emergency if your blood sugar dropped too low for you to treat it yourself. The people you are in the frequent contact with, so your family member, friends, you should make sure that they know how to assist you in treating severe hypoglycemia. If you need glucagon, let your doctor know so they can prescribe it for you. It's important that you put these things in place in case of emergency so you can take care of yourself, take care of your diabetes, and be in control. I hope you have learned what hypoglycemia is, the causes of hypoglycemia, some of the symptoms of hypoglycemia, what you should do if your sugar drops, and the plans that you should make with your educator and your healthcare providers to help you stay in control and stay connected. So take care, stay safe, and see you in the next video. Bye-bye.
Exclusive.